Today has had more difficult news, and there will be more difficult news to come over the days and weeks ahead. This is the sad but inevitable part of a major outbreak, as we've seen all around the world. However, importantly, there has been real progress in cooperation and protection for and in relation to our beautiful older Australians. And Victoria has reported progress in the numbers today with regards to the number of new infections, but there is a long way to go. These numbers are still very significant, and therefore they mean that there will be significant consequences 1 or 2 weeks from now. And so I think it's important that we are realistic and honest about those consequences, but we recognise that progress. I want to give a brief update, and Joe in particular to focus on the work of the Response Centre and Alison in relation to the nursing response. The pandemic continues around the world, and therefore we are part of that great challenge and risk and response. 16.6 million cases. Very sadly, 658,000 lives lost. In Australia, we are now at 176 lives lost and 15,582 cases on the advice provided to me by the National Incident Centre. New South Wales remains stable, but with case numbers that are being tracked and traced every day. Victoria, 295 cases and very, very sadly, 9 lives lost. Lives lost for infections which have occurred over recent weeks as the numbers have grown. And around the country, 4.1 million tests have now been completed, and that testing is an immensely important part of the Australian response. With regards to the actions, again I can update that the ADF has approximately 1,470 members in Victoria engaged across a range of activities. Isolation, checking in terms of different pass points on the road, assisting the police. I've seen them out and about on the streets, assisting in particular, as the Premier set out today, with tracing and tracking, following up contact tracing, door knocking, assisting the Victorian health authorities and the Victorian police in that program. That is improving and strengthening the outcomes as we've had to, as a nation and as a state, scale up that response to unprecedented levels given the case numbers. And then in particular, what we're seeing now is that they have also stepped in relation to the support for the tracing headquarters, and we're seeing stronger and better results continuously as a result. And I also want to praise and thank the Victorian Public Health Unit for their work. It's been 6 long and diligent months, and there are many more months to go, but they are helping to save lives and protect lives. The ADF has also stepped in to assist with the aged care centres. In particular, they are currently, and they have been supporting work at Epping Gardens. We've had a team of nurses there and ADF medical personnel through the evenings, but they are available and being tasked to assist with other support as may be required over the coming weeks. That brings me more generally to aged care, and I know the Prime Minister and the Premier have both spoken today, supported by senior medical leadership. With regards to aged care, as at 9:30am this morning, there are 440 aged care residents who have been diagnosed positive. That's about 5% of the cases in Victoria since April, and about 7% of the cases in July. In particular, what we've seen is that there are 27 facilities who have positive residents. Those are our facilities where, of course, we have the highest concern, and this is the work of Joe and Alison and the teams that they are helping to lead. The Premier mentioned today transfers of 80 residents to hospital from St Basil's, and 34 from Epping Gardens, and 30 from Kirkbrae Presbyterian, for example. The other actions going forward, which I briefly want to set out, the response centre, and Joe will take you through the details of that, but in particular the identification of risk of transfer, prevention, and making sure that there are very strong transition plans. Secondly, the role of the ADF, as we've seen. Thirdly, AUSMAT, the first arrivals are expected tomorrow, and they will come in over the coming week. And then fourthly, the role of state health and the difficult decision which was made in March and repeated again this week with regards to hospital placements has meant that there are more places in hospital, but also more nursing staff and medical staff available to attend aged care and other relevant facilities. And then lastly, the PPE and the infection control. Those elements are all in place, and what we've seen over the last 48 hours is significant progress. This is a difficult day. There are more difficult days to come, and we need to be honest about that. But we are seeing some early promising signs. Too early to conclude that the curve is flattening yet, but early promising signs, and we will continue to do everything we can. I want to finish by thanking our extraordinary nurses, aged care workers, our doctors, our pathologists, and the general population for their commitment to taking difficult actions that will save lives and protect lives. Joe?
Thank you, Minister, and good afternoon. Firstly, just reinforcing that we are dealing with an unprecedented and extremely complex and difficult situation. The other thing is, I'd like to empathise with the families that have residents in aged care facilities, and I want to reinforce and give them confidence that our priority is the care and safety of the residents and safety of the workers in those facilities. What are we focused on here in the centre? First of all, it's about joint approach to identification and prioritisation of outbreaks. So we have now brought together and made sure that those first decisions around disease control are directly linked to operational decisions to maintain the functionality of that facility, but still with the focus on the care and safety of those residents becomes the priority. That's a significant thing. The integration of every end-to-end to make sure that everybody is across the decisions. The second point is about rapid response. Now that's about rapidly getting to the worst case situations and supporting those facilities. The key point here is that the operator and owner of that facility has the responsibility to look after the care and safety of those residents, and we are responding and supporting those operators to maintain that facility. What we're doing is this multifaceted approach brings together Commonwealth agencies and governments, Victorian agencies and governments, the private sector, the hospital sector. Everybody is focused on making a difference in this complex environment. So what are we doing to bolster this up? The first thing is we have agreement that the hospital system will outreach into these facilities, into the higher risk facilities where there are cases but they are still being managed. The Minister spoke about AUSMAT, but how are we going to actually use them? They are to bolster our rapid intervention so that when we have these complex outbreaks that escalate quickly, we have the leadership team, the multidisciplinary team to help stabilise the situation, support the owner and operator of the facility to make sure that the residents there are looked after. The other key thing there is that where medical requirements need to be provided, or where the care cannot be provided or for the residents, they will be moved to hospitals, and you've seen that happen. So they will be moved to hospitals, but that needs to be done through a considered approach and making sure that we maintain and understand the risk of taking those actions. Our success will be the unity of effort, and that's what I'm focused on now. I'm focused on unifying all of these aspects of this system to make a difference. The other key thing is about prevention. We have 776 facilities, and they all do not have COVID infection, and therefore we are increasing and enhancing the training and the advice around PPE, around infection control, and making sure that we don't get further outbreaks. That's the focus, and we are now looking at training options, advice options, and also the outreach model that will actually go in at early stages to provide advice so that situations do not get any worse, or more importantly, that we do not get any more cases. The workforce. The workforce is our biggest challenge at the moment, because, as you're aware, when there are infections and contacts, then our workforce is diminished significantly. I want to reassure all of the workers out there that we are doing everything to make sure that their safety is looked after, and that is in line with PPE distribution, and we've made sure that there are no distribution issues, and we keep monitoring that. We will make sure that we will get PPE out to the facilities where they are needed. The other thing is the point that was made around elective surgery. That will actually assist with the workforce, but we are also reaching out across the state and across the country and looking at options that we might normally not lean on, and how we can repurpose some of our medical capability across the country to support this very, very complex and challenging response today. You've heard we have 4 facilities that are in the high-risk category, and there have been some challenges with that. There is absolutely no doubt about that. But we have put response teams in, and this is a joint response between Victorian Government, hospitals, facilities and other providers into those facilities to make sure that we can stabilise, control and, where necessary, decant patients to hospitals and residents to hospitals. Those 4, and I'll let Alison speak about the detail of that, but everybody, I can reassure you, everybody is doing everything possible to try to identify quickly, rapidly respond, control, and then a focus on prevention. This is something that everybody plays a part in. No single person, no single organisation, no single government can deal with this issue. This is an absolute joint response. And I just want to reiterate, our focus is caring for residents, for their safety and the primacy of life, and just remembering that where residents need hospital care, they are provided with that hospital care. Thank you. Alison, I'll hand over to you.
Thank you, Joe and Minister. Again, thank you to everyone for being here today. My first message today is to all of those workers in our aged care sector, of whom there are many. This is a very challenging time for all of us, and particularly for you as the focus of your work comes under scrutiny. We do rely on you to care for those most vulnerable in our community and to support them through this difficult time. So you do need to look after your own health and well-being too. And I remind everyone in the sector, direct care workers, nurses, doctors, cleaners, cooks, support workers, ambulance officers and ambulance paramedics, that there are support services out there for you during this time, and it is important that you look after yourself. So I encourage you to do that because there is a focus on your work. I also am very grateful to the amazing work that we have seen, particularly in recent days, out of the Victorian public and private hospital system, who have reached out to these aged care facilities, literally almost wrapped themselves around in the socially distancing way we can to support these services maintain the care of those most vulnerable, the residents in their facilities, and assisting with any transfers to acute hospitals that may be needed during this difficult time. They have been absolutely fantastic, stepping out of their normal workplace and going into unusual places and really taking a strong leadership in managing that situation. And as I speak, colleagues from across the country, nurses, are coming to help us with this response. And we look forward to seeing more, but I'm aware, as we've heard, my colleagues with OSMAT training, nurses from South Australia are on the way to help us manage these outbreaks and to keep our residents safe. So again, I thank everyone who works in the aged care sector and those that are out there right now supporting them. If you know someone who works in this sector, who works in the healthcare system, now is the time to give them a shout out or drop them a text and just remind them of the important work they do and how much we appreciate what they do. Thank you.
Thank you. Happy to take questions. I think, Elias, you're in the room, so you get first go.
Minister, why wasn't aged care prepared for this?
So I think aged care around the country has been immensely prepared. We have had, prior to the Victorian outbreak, less than 0.5% of facilities affected, and what we saw here in Victoria was an outbreak which affects workplaces, which affects whether it's offices, meatworks, whether it's school environments, hospitals. I think I'm informed that there are 502 health workers outside of the aged care sector. So right across the community where there is a major outbreak, then, as we've warned right from the outset, any sector can be vulnerable. And this was why we took the actions as early as the 1st of February of closing the borders with China, because we recognised the degree and gravity of a major outbreak. And so 150,000 aged care staff have had infection control. We've had PPE available. What we see, though, is, of course, community transmission leads to the transmission into workplaces or so many other places.
But it is disproportionate to any other healthcare sector or workplace. So can you really say it was well prepared for this?
Well, what we've seen is, again, I'll return to the figures. My advice is that since the 1st of April, as a percentage of Victorian cases, aged care residents represent approximately 5%. Since the 1st of July, aged care residents represent approximately 7%. But they're the most vulnerable, which is why we've, from the outset, put all our resources there, and then facing in one state, with no criticism, no reflection, but a reality that we set out very early on, that it could be anyone at any time, any state at any time. That's why we've added these additional resources to deal with the fact that so many members of the health and medical workforce have had to either leave because they've been diagnosed positive, or for each one of those you have a ripple effect of multiples of others that have had to be diagnosed and have had to isolate as well.
There's been a Royal Commission that's highlighted some of the issues in aged care, and then we've had Newmarch, obviously. So couldn't the government have, with that precedent, couldn't the government have done something to prevent these outbreaks and these deaths?
I think what we've done is exactly that. There are numerous facilities which, without early intervention, could and may well have had cases. But one of the very important points is that no matter where you are in the world, faced with this pandemic, if there are massive numbers of community cases, then it will reach into every area of that community. And I think that's a very important point. The best defence for any community is to not have or to stop that community outbreak. I'll go over the phone to Dana. No, with respect, approximately very similar proportions of public and also private and not-for-profit aged cares have had infections in the area. My advice is that, and I'll go to the evidence that I have. My advice is that it's about 1% less of aged care state homes as a proportion of them that have been infected, and so that's similar, but they are largely in regional areas and not in the hotspot areas. That's a historic trend in Victoria to concentrate state homes largely in regional areas and not in the hotspot areas. More generally, the Royal Commission is going on, so I won't preempt that, but we're the ones that called it. We are the ones that called it. But it is very important, I think, for everybody to recognise that the best and strongest defence is to prevent community transmission. The reason we put in place the hospitals agreement with the states, the hospitals agreement with the private sector, was precisely because, as we said from the outset, that if there's widespread community transmission, that posed an enormous risk to our elderly. I think this is a very important part of the last 6 months to emphasise and to recall. We warned right from the outset that a major community transmission outbreak would have the greatest risks to our elderly. It's been one of our extraordinary achievements that outside of Victoria we've been able to protect and to prevent against this. But where there is major infection, then that reaches into all different elements and parts of a community. Okay, Tamsin?
Thanks, Minister. I just got two questions I'm asking on behalf of someone else, but I'll ask them separately. Premier Murphy today said that he's raised the issue of Victorian counterparts a fortnight ago and eventually rejected the request to have it stopped Sunday. Was there any frustration on your behalf of this to be suspended sooner, given that we really needed to free up hospital capacity for our aged care residents?
Look, I understand this is a massive decision, and we're working in partnership, as Joe has said, with the Victorian government. This decision was taken in March in order to make that capacity available, and it's been taken again. It's a decision which follows from the level of community transmission. We've provided our request and advice to the Victorian government, and they've responded, and I just want to thank them for that. A difficult decision, but already we can see the impact of that. Austin Health is taking the lead as clinical lead in assisting with the support at Epping Gardens, for example. They're able to do that because they have that capacity, and that's an example of why this decision was taken. Tamsin, on behalf of someone else.
Thank you. Professor Murphy also said today that hospital left learned too much about being applied in the Victorian situation. We specifically mentioned communication as one of the biggest issues there, but we've seen over the past week that communication has actually been one of the biggest issues in the battles and, some family members said that they know that their family members were there's been widespread transmission. Even if that kind of thing's been fixed, doesn't that say haven't necessarily implemented all the learnings from the aged care outbreak?
I think the challenge with St Basil's, of course, was there had to be the complete replacement of the workforce. And that's an enormous task, and that's hard for the outgoing workers, hard for the incoming nursing and personal care staff, and indeed the entire staff of the entire facility. And that was a public health decision, understandable but difficult. Transition is a very important part and something which Joe and his team is focusing on. And so as part of that, we were able over the weekend to arrange a meeting with all of the families. It was offered to them, and a very, very significant number participated. I understand there's another a virtual town hall meeting with those families this evening, being co-chaired by Richard Colbeck as Minister. So moving early to that, but there's no doubt that the difficult decision which was taken to replace all staff meant that there were very difficult early days, and I recognise that, and I do think that that's something that we all know for the families has been immensely hard. Okay, Richard.
Thank you, Minister. Should this interstate reserve workforce be ready to quicker as soon as it can, or would you consider kind of employing that style in practice here nurses ready to go if it happens anywhere else?
Well, we have, firstly, there is a general agreement about the readiness and the ability of nursing and other health staff to be able to move. I raised this on Thursday of last week with colleagues, and I think that was an important thing to do. I believe I mentioned it in the press conference of that day. What we've seen is that they're actually moving very quickly. AUSMAT we've called in once there were facilities which had significant issues. And I think it's important to understand that what we saw was a rapid outbreak in 4 key facilities and a response within an immediate time frame. And so what Alison and her team have been able to do, and I've been in contact with the Health Minister and Premier of South Australia, for example, the Prime Minister has been in contact with the Premier, is to arrange for those additional resources to come, and we work around the country. To mobilise and move people is a big thing, but we have ADF, we have nursing staff, and we have AUSMAT that are moving. Okay, Carrie. Oh, sorry, I might just have to turn that up. Hold one sec, Carrie. Thank you. Go ahead. Yes. Yes. Yeah, so that was something we initiated, and it was a very important part of the protections put in place to ensure support for the aged care workforce. It still has some months to run, so if further review is needed, that will occur. And so it's there with some months to run, and as with all of these different elements of government support, as you approach the time, we'll view the circumstances against the supports that are necessary to deal with it. What I am hoping is that we will be in a very strong situation by then, that Victoria will have well and truly passed its fundamental need. And then Jonathan. Well, we have, in fact, already brought in place an electronic prescribing system. This is a massive breakthrough. It's linking with the fact that people are able to have home deliveries. And as with all of these elements, there's a very significant security protocol that's gone over, overseen by the Digital Transformation Agency. Also, we have national security, which looks at all of these things. And so we have a strong system, as we've seen, and the Digital Health Agency plays an important role, as well as the Digital Transformation Agency.
Just on paid pandemic leave for aged care workers, is there government plans to extend that to other areas of the healthcare sector?
So this was a decision of the Fair Work
Yeah.
Commission, and the Attorney-General will respond to that.
Okay. Just finally on aged care, do you think loved ones should have confidence that their family members will be safe in these facilities, these residences?
Yes.
Sorry, just on behalf of a colleague, the nurses that are being recruited to manage Victoria's shortages, do you know much about?
I'll ask Alison to provide the detail here.
So your questions about the nurses coming from?
Yeah, so just how many there'll be, where they'll come from, etc.
So initially we know there are 5 nurse leaders who are coming from with the AUSMAT, the Australian Medical Assistance Team. So what we know is really important in the early parts of an outbreak is the nurse leadership, about ensuring that all of those measures are put in place are done quickly and effectively, and nurses lead that best of all. So AUSMAT are on their way. We know that there are nurses this afternoon flying from South Australia to join us, and I'm very grateful to the Royal Adelaide Hospital and the other hospitals in South Australia who have provided those. I'm working with my colleagues across the country, the chief nurses and midwifery officers across the country, to identify additional workforce. But remember, we're also using that workforce that exists within our public and private hospital systems. Right now, they're the people out there supporting and working with these facilities to make sure they're putting all of the measures in place, and in times having to supplement the workforce if, for instance, the facility manager or the leader of that facility has had to be required to be isolated, someone has had to move in, and I'm extremely grateful to a number of colleagues who have taken on those roles for us so we can maintain the leadership that we know is so critically important. And certainly something we learned from Newmarsh was that nursing leadership does bring order to these situations, and it's a critical part of our success.
Thank you very much. Thanks, everyone.